we focus on the dynamics of injuries, primarily soft tissue injuries. But as part of this functional wellness dynamics and it's changing the world, we have to consider other areas. So many times when I have a particular patient, we discuss issues such as a back injury, but we have what we call maybe a clinically obese individual or an individual with diabetes or a person with metabolic syndrome. In that situation, my team here, Ana Paola Rodriguez Arciniega, who is a master clinical nutritionist, and we have Kennedy Vaughn, who is a health coach here, who is my team. What we're going to be discussing is actually what people experience when they present to an office, right? So one of the first things is once people come in, there's not only a moment of time where we take down that clinical history, but we have to assess what is this that is going on in this particular individual's life beyond not only the present ailment, which is particularly a biomechanical issue, a structural issue, but what is it that is also influencing these dynamics such as chronic inflammation, joint problem, autoimmune disease, neurodegenerative disorders, and we have to kind of put it together because the world of saying, you know what, that's not my job, that's not my issue, you have to go to an internist is short-sighted. But it is required because there are times when people do need that. And most of the times I do refer. But in the meantime, we're going to try to connect the dots of what an internist would do as well as a neurologist would do if that's what's the situation, or an orthopedist. Now, as a primary care doctor, what my job is to do is to know the difference of what belongs in the practice and connect what we treat along with other ancillary professionals. Now, we have a lot of great doctors out here in this particular community, and what we want to do is we want to discuss how we interact in the questionnaire component of that. So today, Ana Paola is going to be initially talking about what we call is the living matrix, correct? Is that, Ana? Is that correct?
Yes, we're going to talk about the living matrix.
We're going to be discussing the living matrix. We're also going to be discussing the body composition dynamics, which is the in-body. And thirdly, we're also going to be talking about the portal of how we accept information with our patients through today's techniques. Now, what has happened in modern medicine today is we no longer can see our patients as much. So a lot has to be mitigated or treated through online services, right? So what we need to do is to give people a little bit of insights as to how we wrap around the patient in the virtual world as well as presented to a clinic experience too, because many times there's a lot going on that cannot be handled in a practice, like a detailed history, clinical nutrition background, organizing certain laboratory tests, but we can do that if we're connected to you in this format here and you have a team wrapped around you. So Ana Paola, go ahead and share your screen, and I'll start talking as you share your screen about what they're seeing, and then I can work you into that. So, well, the dynamic history that we take is real complex, and many times it requires you to be away from a clinic to fill out these deep questionnaires. Now, in these deep questionnaires, what you'll see is a complex series of questions. When people present to us, they present to us like an individual, that with a story. Now, sometimes the story may be really, let's say, verbalized to us in a form of subjective and objective complaints. But what we try to do in this dynamics is we try to teach people what is actually going on in terms of the long history. Now, in the long history, with seeing what is going on before, after, and during the particular episodes, we can also see the dynamics of a presentation that is, I think you have to share, you have to pick the picture on the file and then share it, Ana. And then from there, what we do is we can look at where this problem began. Not only, let's say we have an individual